Hello and welcome to another Oxford Sandy and Black Pig Group podcast. I'm your regular host, Andrew O'Shea. This podcast comes from a very sunny but very blustery Lincolnshire as I sit in my office. I'm kind of glad that I'm indoors, but would like to be outside with the sun, but the wind doesn't look too friendly, unfortunately. So this episode is a replay of an event that was held yesterday with vet Louise Blancon, who talked us through farrowing, medications, experience, what to look for, when to help, etc. Very useful session. It's about an hour and a half long, but very, very interesting and lots of good questions. So I really hope you enjoy that. Before we get on to that, just to update about other upcoming events, we are lucky that the beginning of April, the 8th, 9th of April, exact date and time to be confirmed, Emily Boyce from AHDB is going to be talking to us. Those that also follow the group will have seen that I published the 2021 so far farrowing data, and there were a few questions there. So just to clarify the point, so these are members of our group who have told us that they've had litters. They've advised us what the breeding cell line is and what the boar cell line is, and how many piglets of each sex were born and were alive at sort of a week of age. The data no means reflects any registrations. So far this year we've had 27 litters reported, of which produced 123 gilts and 111 boars. The most popular region out of interest is down in the southwest. I've had 8 litters, 6 in the central region, 4 in Ireland, 4 in Wales, 2 in the south, 1 in the north, Scotland with 1 as well. Northern Ireland yet to report any actual farrowings. On the bloodline perspective, all boars have been used quite equally. So Alexander, Alistair, Clarence, Jack, all equally used for breeding. On the sow bloodlines, we haven't had any reports of any LC or lady farrowings yet. So if you do have, you are breeding those particular lines and you have got farrowing shortly, please do let us know. Right, that's enough of my waffling. So I'll hand over now to Kim, who introduces Louise from the recording of last night's presentation from Louise Blancon.
Well, good evening and welcome, ladies and gentlemen. Lovely to see all your faces. So tonight we've got Louise Blancon, and as you know, Louise is a pig vet, and that is her specialised subject. And she's lovely because she comes onto our group and she gives us her time, and she's quite kindly said that she would come and have a chat with us tonight. So as Andrew said, it will all be recorded, and questions to be put through via the little chat button at the bottom of your screen or the top right, whatever system you've got working, and Andrew will ask the questions throughout. So if you could all please make sure that you are on mute, and we will start the session. Over to you, please, Louise. Thank you.
Good evening, everybody. It's nice to see so many of you here. Kim's kindly invited me to talk to you about farrowing management, and I am just going to attempt to share my screen now with you. I'm not very computer literate, so bear with me. I hope everybody can see that now. Yeah, so we've got a lot to get through. We've only got 1 hour to do it, so let's get going. And as Kim has already said, if you've got any burning questions, just pop them in the chat, and Andrew will pop them to me and we'll try to address them throughout. So the agenda that I want to go through really tonight is checks to ensure that we're ready for the farrowing process itself. What does an actual normal farrowing look like? And more importantly, what does a farrowing which isn't going well look like? When is it appropriate to intervene? How can we actually assist the sow during farrowing? What do we look for to make sure that the sow is feeling well and healthy after she's finished farrowing? common health problems that you might encounter with both the Psi and the Piglet, and a bit about management of the Psi and the Piglet to ensure good health. So cracking on to preparing for farrowing. So the gestation length of a Psi is really, it's easy to remember. It's 3 months, 3 weeks and 3 days, or 115 days. So in preparation for the farrowing, assuming that you've got your service dates, what we need to ensure is that we've got the accommodation clean and disinfected and dried. Drying is really important to make sure that we can minimize the amount of bacteria in the environment. And that's the really important key to minimizing that. Ensuring that the bedding is flat to ensure that the piglets can move away freely from the Psi. That will reduce your lay-downs. If you're farrowing outdoors, make sure that you place your fenders on. Make sure that you've got all your heat sources in your creep areas working and turned on, because you might farrow overnight, particularly so. Move the Psis into the farrowing accommodation quietly and calmly. You guys will all be used to handling all your Psis, so they should be well used to having human contact, so it's not maybe so much of an issue for you guys. I'm used to working with a lot of commercial Psis, and I look after about 50,000 Psis with my clients. If you are farrowing in groups, house the gilts next to the Psis, and one of the reasons why I say that is because it keeps the gilts calm. And it can avoid savaging. So gilt savaging isn't something that we commonly see even in the commercial pigs. And I will run through a little bit more about gilt savaging a little bit later on in the presentation. But one of the ways that we can avoid that, if you are group farrowing, keep the gilts next to the Psis. Turn radios on. Not only does it keep our stockmen happy, but it keeps our Psis during the farrowing process. It keeps them calm and it makes them less reactive to your attendance at the farrowing process. So she's less likely to get up and down, and that again will reduce the number of overlays that you're likely to see. So what are we actually looking for whenever the Psi is about to farrow? So about 2 weeks before her due date, you will notice that the teats will become enlarged and she'll have an increase in prominent veins around the udder, and that's due to an increase in blood supply to the area at this time. The vulva begins to swell and it begins to redden about 4 days before she starts to farrow. The mammary glands become a lot more defined about 2 days before she's due to farrow, and you'll start to see a bit of watery secretion from the teats if you give them a gentle squeeze, and that will happen about 2 days before. Now that secretion from the udder will become a lot more milky when she's about 12 to 24 hours away from farrowing. Once the milk becomes abundant and it easily flows from the teat when you gently squeeze it, the Psi is probably about 6 hours off farrowing at point. The Psi also becomes very restless. She starts nest building, and if you see that, she's probably going to farrow within the next 24 hours. On the day of farrowing, as you can see from this Psi in the picture, they will not eat, so they'll go off their feed. So again, that's a sure sign that she's about to farrow. The absolute imminent signs of farrowing obviously are contractions, vulval discharges, tail swishing, and they tend to lift the upper leg. And I am hopefully going to show you if this streams, and it will depend on how your own internet connection is working at this time. I'm going to show you a video of a normal farrowing process. This is one of my own clients actually. They have freedom farrowing accommodation. And I will just try to play it for you just now. I might just skip forward at certain points because I know when the piglets are coming. And there he is. That was a very fast one. So that piglet came out head first, which is perfectly normal. I'm just going to try to skip it on a little bit for you. So the piglets are actually responsible for initiating the farrowing process in pigs. And the piglets initiate that because there's a reduced nutrient availability, and this stimulates the placenta to produce prostaglandin. This stops the piglets from producing the maintenance hormone, which is progesterone, and that's what initiates the farrowing process. So it's actually the piglets that initiate the farrowing process. Larger litters will often farrow earlier because the nutrient availability will decrease faster. So you can see from this side that she's got intermittent abdominal muscle straining, and it's often accompanied by shivering, which you can see just in the top of the picture. Whenever the piglet's about to come, she often draws her upper leg forwards. The important point to notice is that the straining is always mild, except necessarily immediately prior to the piglet being born. Prior to the piglets being born, you'll quite often see the tail swishing, and that normally indicates that the piglet's about to be born in the next 10 seconds. So at this point, this Psi was having 1 piglet every 3 minutes.
So, Louise, it's a great video. Just had a couple of questions come in on the direct message that I think are quite pertinent here. One is, when should we worry about if there are no signs of piglets, and how long does the shivering last?
Yep. So the first question, thank you, Andrew, we're going to address what is the normal interval between piglets. We're going to run through that in just a second, because that's very important, because we need to know when to actually intervene. The shivering will last usually throughout the entire farrowing process. Once she has passed the placenta, that should stop straight away.
Excellent, thank you.
So I think the important point really to notice is that the Psi is very calm. There's very mild straining. There's very little, you know, aside from whenever the piglet's about to come, there's I think we've got, I'll just skip it forward slightly. There we go. So that piglet, you'll notice, has come backwards, which is perfectly normal also, and it's more common in the second half of the piglets to be born. So that was number 11 piglet, and that was the last piglet to be born. So just going to move on and address the second question, thank you, Andrew, that someone said. It is important to know the typical speed of farrowing and the average intervals between the piglets, because we need to know if this is extended when we need to intervene, and because that's very important, because the longer the farrowing process takes, the more likely we are to see stillbirth piglets. So you can see just there at the bottom, 70% of all the stillbirth piglets that we see are born in the last quarter of the order. And that is very often due to a lack of oxygen. So you can think whenever the piglets are starting to detach from the placenta, the only thing that's keeping them alive is the umbilical cord. And the longer it takes them to get out, the more deprived of oxygen that they become. Now, what I've got on the screen here is very much the average, you know, so gilts with the average duration of farrowing should be fairly short. One, they've got a smaller litter size, and two, they've the muscles are very responsive to the hormones. Size tend to take a little bit longer, about 2.5 hours, and the average interval between piglets for gilts would be about 12 minutes, and for size would be about 18 to 20 minutes. That Psi in the video actually had those 3 piglets 3 minutes apart. I mean, I skipped it on a little bit there, but that was fairly fairly fast. Now, don't be surprised. Don't be surprised if there's about a 40 to 45 minute delay between the first and the second piglet. Thereafter, I would expect the interval to be about 10 to 20 minutes between each live piglet. That's fairly normal. And the reason why it takes longer between the first and the second piglet is because the act of suckling at the teat will release the natural oxytocin in the Psi. The natural oxytocin in the Psi will cause the uterus to contract. So the more piglets she has suckling at the teat, the more oxytocin she has, and the more the uterus will contract. It will take longer between the first and second piglet, but thereafter, these are the sort of averages that we're looking at. So what could possibly cause, unfortunately, things don't always go smoothly, and size will experience some delivery. There's usually 2 reasons for this. The first one is to contract. That's more likely to happen in old size or those in extreme body conditions. So that could be over fat size, or it could be thin size. So that's the extreme of body condition or older size. And it just means that the uterus is not as responsive to the natural oxytocin as what it should be. The second reason, or the second primary cause, would be obstruction. Now, this can be from oversized piglets, so that could be especially in your gilts, particularly if she's got a smaller litter. It could be a malpresentation of a piglet. It could be a dual presentation, i.e. 2 piglets trying to come together. It could be due to fetal abnormalities, or it could be due to a uterine twist. Thankfully, fetal abnormalities and uterine twists are fairly uncommon. So if we encounter one of these problems, when do we know? When is the right time to intervene? So my time is 45 minutes. I would intervene immediately if the Psi was in distress. So if the Psi was contracting at hard contractions and she was not producing a piglet, if she was panting, if she was red in the eye, or if she was visibly uncomfortable. The farrowing Psi that I showed you in the video was clearly fairly comfortable. She was getting on with the process, and she was doing really well. Would intervene immediately also if I saw any meconium in the vulval discharge. So the meconium is basically the first poo of the piglet. If the piglet does that within the Psi, it's distressed. It needs to come out right now, or it's going to be a stillbirth. So if I see any meconium, and I'm going to show you a picture of what that looks like in a second. Failure to deliver the placenta within 1 hour happens very uncommonly, but it would be, you would have to ring your vet and have a word with them at that point as to what to do with regards to retained placenta. May need some hormonal intervention at that point. So I'm just going to deal with the above point.
Sorry to interrupt you in mid-flow there. Seems to be a problem with the signal. Maybe if you turn your camera off, the audio might flow. It's breaking up a little bit, so I don't know if that's down to bandwidth or not, if anyone else is having that problem. A couple of people have messaged to say they can't quite hear properly, so maybe if you turn your video off for a bit, that might help.
Yep, okay, can try that, Andrew, no problem.
That sounds clear, a lot clearer.
Okay,
so let's see how it goes. Thank you, Louise.
No worries, thank you for that. So not everybody obviously watches their piglets or their size farrow. So some people will say to me, well, how do I know if it's been 45 minutes? Well, one of the things I can say to them, look at the degree of dryness as a guide to how long the piglet has actually been born. If the piglets that are suckling the Psi are all dry, the chances are that that last piglet has been born 30 to 40 minutes previous. And if she hasn't had one since that point and she hasn't passed her placenta, then the likelihood is that there's an obstruction there. So that's a picture of the meconium. So you can just see that those dark little brown to green pellets on, this is one of my stockman's gloves. He did actually have to intervene in this case, and he pulled out 3 piglets because we noticed the meconium staining at the vulva. So there's the brown stroke green piglet poo basically at the size vulva. So before we go through actually assisting the Psi, I think it's important to familiarise ourselves with the Psi anatomy, so we actually know what we're doing when we put our hands in there. So this is a picture of the Psi's pelvis and reproductive tract, and as you can see, the cervix rests towards the head end of the pelvic bone, and as does the uterus. It also is in front of the pelvis, so the piglets will have to come through the pelvis in order to be born. So this is the normal piglet orientation to be born. So about 50% of piglets are born head first and 50% are born back feet first. Back feet's perfectly normal, and it's more common in the second half of the farrowing. So if they are coming out head first, they should come out with their front legs bent backwards towards the midline, pointing towards the back legs. So their back legs will be pointing backwards. When the piglets are born hind legs first, their front legs will straddle their head. So the piglets should be born, as you can see from this picture, their back, the piglet back should be facing the back of the Psi. This is important to know because you will see problems if the piglets are born upside down because of the anatomy of the pelvis and the fact that the uterus sits towards the midline of the Psi. The most common issue if presented backwards is the hind legs are facing forwards, and what you would feel in that case is just the bum and the tail. So whenever we're about to assist the Psis, it's important to always wear a gloved hand with lots of lubricant. We do not want to make the inside of the Psi too dry, otherwise we will make the situation worse and she will not be able to proceed with the farrowing herself. So if the Psi is on her right, use your right hand. Put all your fingers together to create a cone shape and slowly ease your arm into the vagina until you reach the pelvis. So as you can see, this stockman is clearly very experienced. He pulled these 3 piglets out, created a glove, he created a cone with his cone shape with his fingers, and he used his right arm because the Psi was laying on her right side, and he eased his arm in nice and slowly. So when you put your arm into the vagina and you reach the pelvis, you'll feel a narrowing of the reproductive tract, and that's because the pelvic bones are surrounding your hand. Once you get past this point, you'll be able to check to see if the piglet is in the correct orientation. So the correct orientation is, remember, the piglet's back should be facing the back of the Psi. Either head first or feet first is absolutely fine, so long as in the correct orientation, back to back. If the piglet is upside down or if the hind legs are pointing forwards, i.e. you just feel a bum and a tail, you will have to push the piglet back and correct the orientation. So if the piglet is coming head first in the proper orientation, i.e. back to back, what you'll have to do is place your index and your middle fingers behind the ears of the piglet and gently pull it forward, shown in the picture. So index finger and middle fingers behind the ears. If the piglet is coming legs pointing forwards, pull both the hock areas and pull the piglet gently through the pelvic canal, as per the picture. Once you've removed the piglet, ensure that it's breathing and make sure you clear the mucus from its nose and its mouth.
Hi Louise, there's a few questions coming along this topic about, how common is it that you have to intervene with a farrowing was one question we have. Obviously, you're on a lot larger scale to us, but I mean, is there a statistic for that?
I would probably say that obviously depending on unit, depending on side condition and parity profile that we deal with, obviously bigger size and older size are more likely to need some intervention. But I would say on average, you would probably have to intervene maybe 1 in 20.
Okay. And another question along that is, how would you know if you're waiting for the last piglet or the placenta? Is there a way to tell if you finish farrowing and you're just waiting for the placenta, or whether there's still a piglet?
No, unfortunately, there's no real way to tell. Aside from the straining will be very mild, but I think she will, once the farrowing is complete and the piglets aren't moved through the pelvic canal, she will seem a lot more contented. There seems to be a lot less leg lift, piglets coming through the pelvic canal. Once that's happened, she should be a lot more contented. She will still remain with the odd contraction until the placenta is passed, though.
Okay. And there's a question that sort of leads on to that is obviously when you're going inside to sort of explore, is there a particular angle you should be going in at with your hands, or straight in, or?
No, well, I'm just seeing if I can skip back. So as you can see there on the picture on the left-hand side, I think it's very important to know the anatomy first. So put your hand in straight back and then at a 45-degree angle down. So once you feel that tightening of the pelvic around the pelvis, we hand in and you'll feel the reproductive tightening, and that's because you're going through that pelvis there that you can see in the left-hand picture. The uterus will then take a dive down because of the weight of the piglets at a 45-degree angle. That pigs have a bicornuate uterus, which means that their uterus is separated into 2 horns. So you will need to check both horns for piglets.
Thank you. There are a few more, there's quite a few questions coming through, but I think there'll be ones that we could possibly answer at the end. So I'll apologies if you've asked the question and I'm not covered it yet. We'll let Louise carry on. It might cover some of them off. Thank you, Louise.
No problem. So one of the things that I very often get asked as a vet is when is the appropriate time to use Reprocin or oxytocin. Just for those who are unaware, Reprocin is basically a long-acting form of oxytocin. So in the case of uterine inertia, where the uterus fails to contract adequately, you can use oxytocin to speed up farrowing. But oxytocin should never be used routinely, only as required and only as directed by your vet. My golden rule about using it is that you must check that there is no obstruction before you inject that into the Psi. And that is because she will, if there is a blockage, her uterus will contract against the blockage and you will potentially rupture her uterus. Okay, so before you inject the size with any oxytocin, you need to make sure that there is no piglet obstructing the birth canal. Okay, as an alternative, I've just popped in the bottom there at blue, in blue. If you're sure that there is no obstruction and you are worried about the speed of farrowing, try rubbing her udder. You're basically mimicking suckling at the teat. That will allow her to release her natural oxygen, and that itself will speed up the process of farrowing. If you're sure that there's no blockage, try rubbing her udder just to speed up the process of farrowing if you're worried that there has been an increased interval. I mentioned this a little bit earlier about piglet savaging, and I've just popped that in really for your reference. And one of the things that I mentioned previously was to house the gilts next to the size, because it tends to keep them calmer. Radios will very often help keep gilts calm as well. There are licensed products and anti-inflammatory painkillers that are licensed during the farrowing process, Metacam oral, for example, or Paracetamol, which is Paracetamol. So those are anti-inflammatory painkillers which can help to alleviate the pain of the birthing process and help to calm the gilts. Move her into the farrowing accommodation good time to make sure that she's got time to relax, nest build, work quietly and calmly around her, provide lots of nesting material. If you can box the piglets away, and usually after the farrowing process has stopped, she will normally calm down. I've put there as a very last resort, you can use a sedative, but as I say, it's a very last resort. It's called Stresnol. It's the only licensed sedative for pigs, but as I say, their last resort, because it will actually slow the speed of farrowing, but is going to be counterproductive.
That's interesting. So we do have a question popped in there about the drugs, and it's actually quite a good question, really. Is can you give human paracetamol?
No, human paracetamol, it's not the right strength, Andrew. It wouldn't be the right strength to give to the size.
Okay, thank you. There's a question there as well. You mentioned that last thing about what do you mean by boxing the piglets away?
So she can't savage them. Take them away from her onto a heat source until the farrowing process is finished.
Okay, understood.
It's basically just to try to stop her from. Yeah, sorry. Very often it is just the pain or the strange sensation, or they haven't experienced this before. Once the farrowing process is actually finished, they usually calm down.
Thank you, Louise.
So hopefully we've got our piglets out. Sorry. So hopefully we've got our piglets out safely, and now we need to know how to manage them successfully. So the three most important factors that influence piglet survival are birth weight, temperature drop after birth, and colostrum intake. And I'm just going to run through a few each of those separately. So smaller piglets, they chill more quickly. They have low fat reserves, and they have a higher surface area to volume ratio, which means that they lose heat very, very quickly. They're less competitive at the teat, and this leads them to have a lower colostrum intake. Colostrum is essential for energy, warmth, and antibodies, and that makes them more likely to be laid on. So as you can see from the table, and again, this is very much worked out on a commercial scale, but piglets of less than 1 kilo at birth have very high mortality rates. Looking at body temperature, so you can see here within the first 2 to 3 hours, it's absolutely critical. You need to get your piglets dried, warm, and suckling within the first 3 hours. So as you can see from the graph, despite the piglet birth weight, all of the temperatures began to rise after the 2-hour period, and that was due to colostrum intake. So just to remember that colostrum is not just about antibodies, it is also about warmth. It's like coming in a cold day and having a cup of tea. It just warms you from the inside. So it's essential to get these little pigs onto the teat as quickly as possible. I've just popped this in for your reference, and of course all your farrowing accommodations will be slightly different, so it is for your reference only, and it outlines preferred environmental temperatures of both the Psi and the Piglet. And as you can see, they're often very, very different, which is quite often why we need creep areas. The Psi is comfortable at 16 to 18 degrees, whereas the Piglets, when they're first born, they need 28 to 30. So that's why our creep areas can be very, very important. So it allows us to keep the environmental temperature of the Psi so that she's comfortable whilst providing that little niche environment for the Piglet. So that's where your heat lamps and your creep areas and your heat mats come in. Also, the Piglets, if they can learn to use that creep area, it will reduce your overlays. So colostrum. So Psi does not produce any more colostrum if she is 20 piglets than if she's 2 piglets. She has a set amount of colostrum, whether she's got 20 piglets or 2. So each piglet needs to make sure that it gets its adequate share of colostrum to make sure that it survives. Now, when I ask people, what is the importance of colostrum? Everybody says to me it's antibodies. It's not just antibodies. Antibodies are very, very important, but it's also warmth, as you can see from that graph with body temperature, and it's also nutrition. So it's really important that the piglets get the adequate colostrum within the first 4 to 6 hours. After 4 to 6 hours, the capacity for the piglets to absorb the antibodies really quickly reduces. So you can imagine large litters, and if you're last born, it's quite a fight to get to the teat. So what we can do with those weak born or smaller piglets, we can strip the milk out, we can syringe feed them. I've popped in there, you can give them about 30 mils 4 times in the first day. You can give them colostrum paste. There are colostrum pastes available, such as Porky Boost, Lifeguard FE. It has a bit of iron in it. But these should be viewed as an energy source only. They are not a substitute for the Psi's own colostrum. I always say that to my clients. I view it as a tool to give the piglet energy to get onto the teat itself. It's better than nothing, but it is not a substitute for the Psi's. I've popped in the bottom there that the piglets, that they must suckle their own mother for 12 hours prior to cross fostering. That will only, obviously, you will only cross foster if you have groups farrowing, and it's probably not very common in your breed of pigs. But it's very important that the piglets suckle their own mother. And just a graph, just to reiterate just how important it is within the first 6 hours that those piglets get those antibodies, because after those 6 hours, those antibodies drop away very, very, very rapidly. And the capacity for the piglet to absorb it drops off rapidly also. So I mentioned how we can ensure adequate colostrum, and one of the ways that we can do it is by split suckling. I recommend this in large litters or where there's more piglets than teat space. So count the number of piglets you've got, count the number of teats the functional teats that the Psi has. And if there's more piglets than teat space, or if there's a larger litter, you can do what we call is split suckling. Now that involves, what I will normally do on a commercial scale is my clients will mark the firstborn, for example, 6 piglets as the Psi farrows. We will let her finish, and after the farrowing process, has a litter, or if there is more piglets than teat space, we will start to split suckle at the teat. They should have nice full bellies. They should be feeling very strong. And what we can do is we can box them away under the heat lamp for 40 minutes. 40 minutes would be about the maximum amount of time I would lock them away. It gives the smaller last born piglets a chance to get their share of the colostrum, but after 40 minutes, you must let the rest of the piglets out to suckle. The reason being is that the Psi will naturally want to suckle the piglets at least once every hour, and should you lock the piglets away for more than 40 minutes, they could become weak themselves. So just for 40 minutes, and it allows those last born smaller piglets a chance to suckle the colostrum. Do not lock away any piglets that have no gut fill or that are small.
There's sorry, Louise, is quite a pertinent question popped in there again there. So obviously if a piglet's not willing to suckle, someone's asked for advice on how do you encourage a piglet to suckle if the sow turns into a T-Rex after farrowing, i.e. rather grumpy sow. How would you try and encourage that?
If it was a grumpy sow that wouldn't let you strip out any milk, then you have to look down the lines of colostrum replacers. I do not find that sows are very commonly like a T-Rex post-farrowing, and very often even the grumpiest sow, if you rub her udder, she will very quickly lie down. The release of oxytocin has a very naturally calming effect on them, and they will tend to, even the grumpiest sow will tend to roll over and let the piglet suckle. If that piglet is too weak to actually suckle itself, I would strip out the milk into a cup and syringe feed it. The syringe feeding, you can stomach tube them, but again, you know, you need to feel very competent about doing that to ensure that you're actually stomach tubing into the stomach rather than into the windpipe.
Thank you, Louise.
So I've just popped in here my lovely picture of all my piglets suckling. And they tend to very quickly organize themselves into a hierarchy. The biggest, strongest piglets will always suckle from the front teats, and that's because there's a better blood supply and better milk supply at the front. Each piglet will suss out its own teat space within the first 24 to 36 hours. The sow will suckle the piglets about once every hour, and the milk letdown is only let down for a few seconds once every hour. And if you're not there when it's let down, you've missed it. So that's why it's very important to ensure that every piglet has its teat space.
Yeah, so there's a question come in on that as well. So how do you, quite often if there's two piglets fighting for one teat and there's obviously the stronger piglet, how would you deal with a weaker piglet, the one that's not managed to claim a teat?
Assuming, Andrew, that she has adequate teats, and what I say to my clients is it has to be functional teats. So not be enough functional teats. Is there a button teat or is there a blind ending teat on the sow that is not producing milk, or has the sow got a mastitic teat? Something that you need to look into. If they're fighting for teat space after the 36-hour period, there could be something wrong with either the number of teats that she's got or her milk supply. If that is the case, and there isn't adequate milk supply or teat space, you need to look into supplementary milk.
Thank you.
So post-farrowing checks on the size. So the placenta is typically passed within about 4 hours of the last piglet. And once the afterbirth is passed, the sow generally feels very contented. She should be talking to her piglets, and the hind leg movement and the shivering will stop at that point. There might be, just to note that there might be slight vaginal discharge, which is perfectly normal up to about 4 days post-farrowing. Now that is normal, provided that the udder is normal and that the Psi is eating well, okay?
So yeah, so just go back onto that point one. There was a few questions earlier about the placenta, and how do you determine if the entire placenta has come out? Should you remove it from the sow, or should you let the sow gill eat the placenta? You know, is there benefits in that?
Yes, Andrew, it's very common that the Psi will eat the placenta. If doesn't, obviously it needs to be removed and disposed of appropriately or down the correct disposal lines. As I say, the placenta will normally pass within about 4 hours. I would not pull the placenta out. That needs time to detach, and what you need to ensure is that she's not, if you will risk some internal bleeding if you do pull the placenta. It will detach naturally and it will come away, and the Psi will feel very contented. If you have a placenta, you'll quite often see increased vaginal discharge, which will become very smelly and purulent. As I say, some discharge is normal up to about 4 days, but if there is retained placenta, it will go beyond the 4-day stage.
Thank you, Louise.
So, which leads us on to signs of ill health in the Psi. So, if the Psi is not feeling well post-farrowing, obviously she will stop eating. She will not get up. You will see this purulent vulval discharge if she's got a bit of metritis. Look at her udder. She might have mastitis. It'll be hard, it'll be red, it'll be swollen, it'll be painful. She won't want you to touch it. She probably won't want the piglets to touch it. And she could be udder guarding, which means that she will lay on her stomach and refuse to let the piglet suckle. She may even stop milking altogether. And what you will see then is very narrow, hungry piglets trying to encourage the Psi to roll over and let them suckle. If it goes a bit further than that, you may even see discoloration of the skin, and that will indicate that possibly start of septicemia. Always check for fever and a normal Psi temperature, or a fever of a Psi, I should say, a fever of a Psi, and that is not on farrowing day. So farrowing day, the temperature will naturally increase. But beyond farrowing day, anything above 39 degrees Celsius will be considered a fever. So one of the most common things that we see in the commercial world or in pigs is what we call MMA. So that is mastitis, which is inflammation of the udder, metritis, which is an inflammation of the uterus, and agalactia, which is a posh word for no milk. So you don't necessarily see all the signs together. You may see one sign, you may see two together, and be feeling very unwell. She'll have hard, red, hot, painful udder. It could be an individual teats. It might be more than one teat. She'll have a purulent vaginal discharge, and again, she will have those hungry, empty piglets, either because she's totally stopped milking because of the infection, or she's too sore to let them suckle. We very commonly see this about within 3 days of farrowing. Treatment-wise, antibiotics, I would give her a course of something along the lines of pen strep. Anti-inflammatories, which is your maloxidil, metacam, loxicam, any of the above. And she may also need the oxytocin and reprocin to allow the milk letdown and to help the piglets as well. The reprocin, as I say, is a long-acting oxytocin, so 80% the oxytocin in this case. Reprocin will last up to about 24 hours. So the represent will save you having to repeatedly inject your size with oxytocin.
So, yeah, so there's a few questions come through there on the mastitis as well, and one was around if obviously milk's not come down in 24 hours, what should we do? What can we do to treat mastitis? I think you've covered that, but one question is, should we have the antibiotics for mastitis and the anti-inflammatories on hand, or is it something that we should deal with on an individual basis, bearing in mind that we are not large scale like these commercial farms that you're used to dealing with?
I think it's never a bad idea to have some penicillin and some anti-inflammatories on board. And I mean, the anti-inflammatories, they have more than one use, not just mastitis. You know, you can use it. It's a bit like ibuprofen in UNI. You would use it in cases of lameness or any case of inflammation. I think that I suppose it's at the vet's discretion, I suppose, to dispense it. But I suppose on a commercial scale, I'm talking about, yes, these sorts of drugs will be on site, readily available for these conditions, because this condition is fairly common. Just going back to the farrowing process itself, if you were to intervene with a farrowing sow, I would always cover her with an antibiotic.
Thank you.
So with these cases of MMA, what actually predisposes to it? Well, two main things really. One is farrowing house hygiene. Obviously, at the time of farrowing, the cervix is open, so the piglets can come out. But equally, the cervix is open, so bacteria can get in. So it's really important to make sure that your farrowing accommodation is spotless around the time of farrowing. More commonly on a commercial scale, what we find triggers this is increased pre-farrowing feed. So feed intakes pre-farrowing are too high. So what we actually need to do to prevent it is we need to lower feed intakes pre-farrowing. So if you overfeed the sow before she farrows, it can cause udder congestion, and that can lead to the mastitis in itself. So the sorts of feed levels that we would be looking at on a commercial scale for the 3 days before the sow farrows, so for 3 days before the sow farrows, we will lower her feed intake to 2 kilos per day. Now that sounds quite low, considering that our size will probably be eating around the 3 kilo mark before they actually come in. If your sows become agitated, or if they aren't content, you can actually add some bran to that 2 kilos. So the bran will, it's very low density. It'll allow a lot of gut fill for her, so she'll be a lot more contented. And because it's bran, it will also help with any constipation or any obstruction that she might be experiencing at that time. So 2 ways to prevent MMA. One is lower the feed intakes pre-farrowing. So for 3 days before she farrows to 2 kilos max, and ensure hygiene at farrowing time. One of the that's just a diagrammatic form of what I've just said. One of the things that Kim asked me just to mention was about sow prolapse. Now that's actually usually seen before farrowing. So vaginal prolapses are normally seen to an increased abdominal pressure, together with a relaxation of the internal structure that supports the cervix. So, excuse me, so old sows that are heavy in pig, with large litters and in very good body condition, are likely candidates to experience this. Also, if you've got a very slippy environment, or if the sow's fed high starch diets, that can predispose to vaginal prolapses also. If the prolapse remains when the Psi is standing, we can pop a suture across the vulva to replace that, which obviously will need to relax after farrowing. If you experience a uterine prolapse, I haven't put a picture in there of a uterine prolapse because it's not very nice. If you experience a uterine prolapse, it's not successful to replace it. The Psi often experiences internal hemorrhage, at which point, you know, you really have to consider euthanasia and welfare grounds. So hopefully we'll never see that. Just a little bit about piglet processing. You guys will probably do a lot less than what we do. Two things really that you can consider. Iron, you can give the piglets an injection of iron. If you're going to do that, that must be before day 3, because the capacity to absorb iron for the piglets dramatically reduces after 3 days of age. A lot of your piglets will be outdoors, so you could question the need to actually do that. Whereas our piglets are more reared inside, so we would routinely give an iron injection before 3 days of age. One of the other things that we routinely do is we give Baycox, which is to reduce piglet diarrhea from coccidiosis, and that needs to be done around day 3 to 6. There's lots of combinations on the market. That's usually an oral product, but there are some new ones that are actually injectable and are iron and Baycox all in one. And again, I've just popped in very small writing. Again, I don't envisage that you guys will be doing any of that, but we would consider teething and tailing our piglets, and we'd only do that under veterinary advice where we deemed it necessary for piglet or Psi welfare.
Sorry, can you just clarify there on the iron and the Baycox? Is that an injectable, or is that an oral paste, or, you know, something like that?
Thank you, Andrew. The iron is always injectable. The Baycox is depending on what product you want to use. The Baycox is normally an oral doser, but there are new products just coming onto the market at the moment which combine iron and the active ingredient, which is Baycox, and that is an injectable.
Thank you.
So just moving on to a little bit about creep feeding. So on a commercial scale, we'll normally creep feed our piglets from about 4 to 7 days of age. There's several benefits of doing this. It prepares the piglet's gut for carbohydrate-based diets. It minimizes weight loss in the Psi by taking the pressure off her milk demand, and it also improves growth rates and weaning size. The key to creep feeding is to feed little and often and keep it fresh and palatable. If you imagine what's actually in creep feeding, it's very milk product based, so it's very important to keep it fresh. We normally feed the creep to the piglets whenever we're feeding the Psi, because if the Psi is up and eating herself, it means that she's not feeding the piglets, so the piglets will naturally want to copy her and hopefully take on some more creep. We keep it towards the head end of the Psi, so that again the piglets can copy, and we always keep it in a cool area. So just wanted to run a little bit about Psi Feed Intake, my Psi milking, improve weaning weights, and to safeguard the subsequent reproductive performance. Some of the ways that we can improve our intakes are to keep the Psi at a comfortable temperature, i.e. 16 to 18 degrees. We can increase the frequency of feeding, and the interval between feeds should be even. The feed should be a high density lactator, and the Psi should have access to ample clean water. If you're using nipple drinkers, the minimum flow rate that we would advise is 2 litres per minute. And then obviously ensuring that the Psi is actually in good health herself by regularly checking for signs of ill health. So on a commercial scale, we'll be looking at the following feed guide. So as we said, around farrowing time, she'd be on about 2 kilos per day at the point of farrowing. We normally increase this by 0.5 kilo per day up to ad lib. So she should be eating basically. So just moving on to what vaccinations we commonly use. So this is by no means a comprehensive list of vaccinations, but it's those that I've deemed most important and the ones that we would most commonly use. Their vaccinations are a bit of a minefield, and obviously you'll need to consult your vet and what they recommend your vaccination schedule should be. That will obviously depend on the existing health status of your pigs and also the anticipated risk for your unit. So I hope, or I think that most of you will be using Parvo. So erysipelas Parvo virus, we should be vaccinating our gilts before they're served. So at least 4 weeks before they're served, the gilts will need 2 times erysipelas injections and 1 time Parvo virus injections. They'll need those 2 injections separated by a 4-week interval, and they will need that at least 4 weeks before they're served. The Psis will get a booster every cycle in the farrowing house on a commercial scale. So once the Psis are farrowed, we will booster them with the erysipelas and or Parvo virus. The erysipelas side of the vaccination will last 6 months. The Parvo virus side lasts 1 year. So there are products on the market such as Porcellus eri, which just does the erysipelas, or there's Porcellus eri Parvo, which is a combination. It will do both. If you can't remember what you've given your Psi the previous time, it will do her absolutely no harm to booster her with eri Parvo every time. It's just a little bit more expensive, obviously, to have the eri Parvo than the eri on its own. There's also a few other bits that I've mentioned on here, a few other vaccinations that we commonly use. So PRRS, which is PRRS, so that's porcine reproductive and respiratory syndrome. That's a very frustrating viral disease for us at the moment, which causes us great trouble to try to control on pig farms. It causes late abortions, dropouts, poor conception rates, non-viable piglets, and respiratory disease. The vaccines that we use for PRRS at the moment, they're live vaccines, but unfortunately the virus that's in the vaccines is about 13 to 14 years old. And of course, we all know how good viruses are at mutating, especially recently. So it causes us great frustration to try to control that. So one of the other things that we very commonly vaccinate for, in fact, always vaccinate for on a commercial scale, is PCV2, which is porcine circovirus, and that is AKA, also known as wasting disease. Those will very often be vaccinated for in combination with enzootic pneumonia, which is MHIO. So that, and we'll always vaccinate our Psi and our piglets for wasting and MHIO. So the piglets will be done at weaning time or shortly before weaning time, and the Psis will be boosted once as a gilt and plus or minus any boosters that we feel necessary depending on each individual farm herd health. The E. coli and Clostridial side of the vaccinations. So the E. coli and Clostridial vaccinations will be given to the Psis just before they're farrowed. The gilts require 2 vaccinations at 6 and 3 weeks before the farrow, and the Psis require just 1 top-up booster 3 weeks before the farrow. Now, the E. coli and the Clostridial vaccinations are very often there to protect the piglets, and that's why we give them at that time before the farrow, to ensure that there is passive transfer of antibodies to the piglets. And again, that goes back to our colostrum management. If we are vaccinating the Psis in order to enhance antibody in the Psis to protect the piglets, it relies on good colostrum intakes in the piglets to ensure that a passive transfer has occurred. Now, if we're in a smaller group, I would ask everybody to guess what this was a picture of. Now, this is a very classic picture of Parvo virus. So with Parvo virus, what you tend to see is anything from live-born piglets to normal stillbirths with varying degrees of mummified sized piglets. And the reason for this is because the Parvo virus, the virus, tends to move sequentially along the uterus, and it'll kill one piglet at a time. It will kill one piglet and then it'll move on to the next one. And that's why we see piglets at various stages of development with the Parvo virus. So this is a classic picture of erysipelas. Erysipelas, if you see red diamond-shaped skin discoloration, very classic of erysipelas. What can also see with erysipelas, it can also cause lameness, death, because erysipelas can cause cauliflower-like lesions to grow on the heart valves. And it means that the heart valves cannot open and close as they would normally, and the pig overexerts itself, and you can cause it, and you can see a sudden death because of that. Does anyone have any questions about the vaccinations, Andrew?
Yeah, so there was a question here. Do you recommend the use of Engelvac, Microflex, and Circroflex vaccines for piglets at 3 weeks of age?
Is there anyone from Engelvac on the line?
I wouldn't have thought they. I wouldn't have thought they were. No.
I wouldn't, Andrew. The reason being is that the combination vaccines, so the combination vaccines, which include MHIO and PCV2, often have very good efficacy for the PCV2 component, but a very, very, very poor efficacy for the MHIO portion. And I'm afraid that that vaccination is well renowned for that.
Okay, thank you. And another question was, are these vaccinations, that you recommend for the sow and the cycle, a must? I believe you said that you should consult with your vet about your about the relevant vaccines that you need, but the question was just around, do you recommend these vaccines? What's your guidance?
Yeah, I mean, obviously, without knowing each individual unit, I couldn't profess to write a vaccination schedule for you, but I would say as a very bare minimum, you should be using Parvo in your size routinely. The other vaccinations, as I say, will depend on your herd health status and your perceived risk of your of a potential health breakdown. What's the vicinity of your pigs to somebody else's? What problems do you see in your pigs? Do you see piglet diarrhea very often, in which case, if you do, is it E. coli? If it is E. coli or rotavirus, then we can vaccinate the Psis to try to prevent that in the piglets.
Okay, thank you. And just one question about I can never pronounce it, the Irolipsius, the one with the diamond shapes. the question is, does it always show as diamond shapes, or are there other ways that erysipelas can be shown?
No, erysipelas, you don't always see the diamond shapes. If you do see the skin lesions, it is, as I say, it's pathognomonic for erysipelas, which means it cannot be anything else really. But the two other presentations that you can see with erysipelas is lameness, and the other thing is sudden death. So because it causes heart valve lesions, pigs can drop dead. The erysipelas is more common in summer weather when pigs are wanting to wallow in muck. So you will tend to see it more in summer months.
That's interesting, thank you.
So one of the which is recorded as piglet mortality is overlays. I mean, we would record more than half of the piglets as being overlaid, but I don't accept that as a reason in itself. Yes, of course, healthy piglets can be overlaid, but what I'm asking you to do is look at the other possibilities to make sure that we've ruled them out also. Has the, was the piglet weak? Had it had adequate colostrum? Was it ill? Was there any signs of diarrhea? Was there any signs of any joint infection? Any reason that that piglet could not get out of the way of the Psi? Most of the piglet mortality that you will see will be in the first 3 days, and it varies farm to farm. One of the most common diseases that we tend to see in piglets is diarrhea. Now, Clostridial perfringens, which is the top left-hand picture, it very often presents as hemorrhagic diarrhea or sudden death. It seems to be a very, very acute disease in suckling piglets. The ETEC, which is your E. coli. Sorry, that word PED shouldn't be there. The top right-hand picture is E. coli, and the bottom left-hand picture is rotavirus. So E. coli and rotavirus are very often clinically very hard to differentiate looseness, and they both tend to occur within about the first 5 days of birth. Now, both of those can be associated with very high mortality. How would we treat the likes of these loosenesses? Sorry, I missed out the coccidiosis is the bottom right-hand thing. So it's a bit of a later looseness. And it is not watery, it tends to be pasty white, quite often referred to as a salad cream type looseness, just to put everyone off their tea. And looking at how we could actually treat these types of diarrhea in piglets. The Clostridia, as I say, will very often be a sudden death, or it'll be a very acute looseness. But Clostridia is very sensitive to penicillins, and that would be your treatment of choice for this kind of looseness. Now, of course, before you start treating these piglets, what I would recommend is that you take a swab and get it into your vet and get a culture and sensitivity, just to make sure we know what we're dealing with prior to actually starting any treatment, because once you've injected the animal, it's very difficult to get the E. coli and rotavirus. The rotavirus is a virus, so it's a bit like going to the doctor with flu. He'll tell you to go home and TLC. Rotavirus will often, though, occur in combination with E. coli. So it not necessarily one or the other. You can get both together. Now, if you have the E. coli component, it's usually very sensitive to drugs like Noradine 24, Spectam oral. So that's an oral paste into the mouth. And with any kind of looseness, we would always recommend putting electrolytes down to the piglets to ensure that they don't get dehydrated. The coccidiosis, so the coccidiosis is a bit, it's a parasitic, I suppose for want of a better word, more a parasitic looseness. It does have some anti-cocci component to it. So if you did see a coccidiosis-like looseness, you could use Noradine 24 to treat that. And then obviously going forward, you'd be looking at using things like Baycox to prevent it. If you did see looseness in your piglets at all, we would always treat what we can see, but then we would have to look at prevention. Now, all these types of looseness can be prevented either by vaccination of the Psi. So we can vaccinate the Psi to produce antibodies to get that into the colostrum to protect the piglets. And we can do that for Clostridia, for rotavirus, and for E. coli. Coccidiosis, we can prevent that by giving the piglet the oral Baycox at 3 to 6 days of age. And just to clarify, the age predilection for the piglet looseness, just to put it in a graphical form for you. So the E. coli very much within the first 5 to 7 days of age. The Clostridia tends to also be very young piglets. And again, as I say, it's a very acute sudden death and hemorrhagic looseness. Coccidia tends to occur a little bit later on in piglets, and it can happen anywhere between sort of 10 to 14 days is the most common range, but it can extend to the 21-day-old piglet. They can get a little bit of dietary looseness because when you introduce carbohydrate-based creep powders. Does anybody have any questions about the piglet diarrhea?
So there was one question around what's the best disinfectant for indoor farrowing for cleaning out your pans?
Yeah, very good question. Thank you, Andrew. We would recommend the use of Virkon S.
Okay.
But if you have coccidia problems, the coccidia is very frustrating because it when it replicates, it produces what we call an oocyst, which is basically an egg, and it has a aversion to most disinfectants, particularly frustrating if you've got irregular surfaces such as concrete, etc. It's very hard to get rid of in the environment. So the disinfectants that you would be looking to use if you were worried about coccidia would be Kilcox or Biocyst.
Okay.
They're very coccidia specific, and on our farrowing house systems, we would very often alternate our disinfectants to include Kilcox or Biocyst in the program.
Okay, thank you. And there's also a question about green poos in piglets. What does that indicate? I think you covered that with the E. coli one, did you? I can't remember.
Yeah, again, piglet looseness. It depends whether it's watery or it's pasty, or it depends on what age the piglet is. As I say, the E. coli and rotavirus and Clostridia tend to have fairly high mortalities. The coccidia, not so much. Are they introducing any feed at that point? Is also a question. If it's a sort of dark, greeny black looseness, it's very often dietary related. If it has more of a sort of brown yellow tinge, there could be an element of E. coli in there.
Okay, thank you. And the final question on the list here is, what brand of electrolyte do you use or would you recommend?
There's so many on the market at the moment. I tend to use the local one, which is at East Riding Farm Supplies. So it's much of a muchness, really. Whatever your local farm supplies has.
Okay, thank you.
I think to the person who asked the question about the green looseness, if it's something they're worried about, just submit a swab into your veterinary practice. A culture and sensitivity should be about £25. If it's something that they're worried about, it will rule out anything nasty like E. coli or Clostridia. I think a rotavirus test is possibly an additional £15 to £20. And a coccidia, you can look at that under the microscope in-house. So, you know, that those sort of diagnostics don't really break the bank.
Okay, thank you.
So just finally, just wanted to run through, I've mentioned several times about injecting pigs, so just wanted to roughly run through some injection techniques. So the intramuscular one, obviously it goes into the muscle, and the reason for that is because it has a good blood supply, and that allows it to have a good distribution around the body. And that's really important to make sure that you get the right needle length to ensure that it actually goes into the muscle rather than in any subcutaneous tissue or any ligament tissue. So when you're talking about a piglet, you'll use a small 5/8 21 gauge needle. Weaners and growers, a 1-inch needle. And once you get to finishers and adult pigs, you should be looking at using a 1.5-inch needle to ensure that you're getting into the muscle where the best blood supply is. So my preferred site of injection is in the neck. It means that you're 0.3 in the hind leg. You're at risk of damaging the sciatic nerve at that point. So I would always prefer to inject in the neck, just behind the base of the ear and at a right angle to the skin. So he's not quite at a right angle to the skin, but just for showing you purposes. So I just went straight into the muscle. So that's the correct position and angle. Just to show you whenever it's too high. So that'll go into the ligament tissue in the neck. And what you can often find is that might cause an abscess. And if you've injected your vaccination in there, you can be sure that you've wasted your money. And that is too low. It could go into fat or subcutaneous tissue. So there again, if you get it too low, you can see how it's missing the muscle. And again, if you use the incorrect needle length, you're just going into the subcutaneous tissue. You're at risk of the vaccination or antibiotic not working, and also at risk of causing an abscess on the neck. So I think that we're pretty much out of time, and that was a very, very fast whiz through farrowing house management. And thank you for listening, everybody. If anybody's got any questions, I'm going to try and put my video back on.
Yeah, so thank you very much, Louise. It might be best if you just turn off your screen share as well. That might help with the thing. I think I've covered off most of the questions that we've had through on the direct messages. They seem to be there's common themes. So if you have messaged me with a question and it's not been answered, you feel free to shout out or message me directly. One question that has come up a couple of times, Louise, is your slides have obviously been quite useful. Is that something that you'd be happy to share with us? Or are they proprietary to you? And I totally understand if they're your slides that obviously you don't want them overused.
Yeah, yeah, certainly. Yeah, can share those, no problem. Yeah, most of them are my videos anyway, and I can reference those that aren't.
So, and we have one other question is there's things about hereditary things, problems in farrowing. Is that something that's passed on hereditary? You know, problems with birth, is that hereditary, or that just tends to be something that's specific to the cow based on the pig, sorry, based on the environment and the way it's brought up?
I think farrowing problems, there's so many things that that influence the farrowing process itself. What is hereditary, Andrew, is birth weight, which is something that we strive to achieve on a commercial basis because we have very big litter sizes. So we want them to be very big, but and also birth weight is related to survivability of the piglet. So the bigger they are, the more likely they are to survive. But if you have a particular sow that has had dystocia because of fetal oversize, then that is likely to be hereditary. Birth weight, as I say, is hereditary, but also birth weight will depend on her litter size.
Thank you. Are there any more questions? Feel free to unmute and ask away if you have anything specific that I've missed.
I know it was a very quick whiz through. Don't be shy if you've got any specific questions.
So there's a question here. I think this probably very much differs from commercial to our rare breeds. But at what age should you stop breeding a sow?
Yeah, good question. That's a good question. So long as I suppose, so long as she's fit and healthy and producing how you want her to, we tend to find on a commercial scale that the performance of the sow will drop off. So if the performance of the sow starts to drop off, we don't tend to keep them past sixth parity. But so long as she's happy and fit and healthy and she doesn't have any problems or hasn't previously had any problems, then crack on.
So there was another question about reiterating around that you mentioned about dropping the feed of a sow a few days before giving birth by a third, from 3 kilos to 2 kilos. So someone's asked, my sows are on 2 kilos feed now. What do I drop prior to farrowing and how much do you increase after?
So if they're on 2 kilos just to maintain their body condition, I would probably put them to 1.5 kilos. And if that, as I say, you can add extra bran to achieve some gut fill at that point. After she finishes farrowing, so on the day of farrowing and the day after, you will probably keep her on about 1.5 kilos. She won't be interested on the day she's farrowed anyway, and she will only just be starting to get onto her feed curve the following day. I normally start increasing the feed by about 0.5 kilo per head per day after the point of farrowing, up to the point where she'll be on ad lib. Now, ad lib on a commercial scale for a gilt, I would say she should be eating about 8 kilos per day. For a sow, we'd be looking to achieve at least 10.
Thank you. So a question here about blood from the vulva. What does that indicate?
So that can either be detachment of the placenta. So if it's during the farrowing process, if there's excessive blood, I would look to intervene at that point. So I would put my hand in and see if there's a piglet stuck. The inside of the uterus is obviously very vascular. So it could just be that the piglet has scraped, but there could also be an obstruction. So I think I would intervene at that point. Okay,
thank you. And a couple more questions here around as to when you would first breed your gilt you'd first put to the board. I mean, is there an age that you would recommend? Me personally, I very much suspect that's down to the actual size of the animal rather than the age, but I'll leave you to comment on that.
Yeah, I mean, in terms of the rare breeds, and I mean, Kim could probably correct me if I'm wrong, but I can only I can only say what we do on a commercial scale. So we very much look at age and at body condition and weight. So the sorts of targets that we would be looking at would be we would breed our gilts at about 240 days. And at that point, we'd be looking for her to be a minimum of 140 kilos.
What's that? It's like 9 months old then, is it? If my maths right, 240 days, 9 months, thereabouts? Was my math way out? Something like that, yeah. Okay, thank you. And the question, obviously, if sows have a problem, I mean, if a sow has mastitis on one particular farrowing, you know, should you consider not breeding from her again, or that tends to be a, you know, does that have a long-term issue?
The result of the mastitis will very often be reflective of how fast it was picked up and how fast it was treated. If you pick it up very quickly and you resolve the mastitis, she will very often lose function during that lactation, but she may well return to lactation on that teat if the damage hasn't been too great. If you've picked it up very quickly, she could return to lactation on that teat.
Okay, thank you. I'm just going to do one more question, conscious that we are over time, and you know we're very much appreciative of everything that you've asked. Where's a question I just saw that I wanted to ask there that we've popped through? I've lost that question now. There's a few lots of people saying thank you very much for your time. Lots of questions about the age, which we've covered. What should you do if blisters occur on an udder?
Well, find out the cause of where the blisters are coming from. I think that you would have to look at what the flooring was like. One thing that might have occurred is look at your cleaning and disinfection products. If you've used lime, very often it can cause burns unless it's been allowed to cure for a few days before the sows actually go in. So I think the first thing to check off would be the environment that the sow was actually in at that time and what was the actual cause of the blisters. Remove what the cause was, but then obviously address the blisters themselves. So use pseudocreme and if necessary a penicillin-based antibiotic. If she's uncomfortable, which I presume she will be if she's got blisters on her udder, you would also consider using an anti-inflammatory painkiller.
Okay, thank you. Well, so say yeah, lots of questions coming through. Sorry, lots of thanks coming through. Really appreciate your time, Louise. It's been a very useful session. Lots of good. I've certainly learned a considerable amount, and thanks to everyone for all your questions, and apologies if I have missed them. There have been a lot come through. I've tried to sort of group the topics to rather than repeat the questions. If you do have a question that hasn't been answered, that I haven't answered, please drop me an email and I'll try and see if we can get an answer to that for you. But thank you very much for your time, and thank you very much, Louise. Very useful, very, very useful session.
No problem. Thank you all for coming.
Thank you.
Well, I'm sure you'll all agree that was a very interesting evening, and thanks again to Louise Blancon for taking the time to share all that great information and experience with us. And that brings us to the end of another podcast. As always, I've been your host, Andrew O'Shea. Happy pig keeping.